Good evening, everyone,
Good
and
evening.
welcome to yet another session of the sip of the day for the Memory Cafe. And as I was seeing my patients, the number of cases of dengue on the rise in the state of Goa. So it's very important that we understand what are the things we need to do when there's an outbreak of dengue, such that we protect ourselves. So one, we need to understand what causes it. So it's a virus that causes it. What are the implications to us, whether it's a virus causing it or a bacteria causing it or a fungus that's causing? We need to understand it's a virus. So antibiotics that you normally give for some kind of infections will not act against the dengue virus. So the normal antibiotics, amoxicillin, etc., they will not act against the dengue infection. There are 4 viruses that can cause dengue infection. Virus 1, virus 2, virus 3, virus 4. What does that mean to us? It means that if you get infection with one virus once, you can get another infection with another virus next time. So you can get another attack of dengue later on. You can get a third attack of dengue later on. So people can get multiple attacks of dengue. The problem is if you get a subsequent attack of dengue, that is, you had dengue infection the first time, you get another attack of dengue, the chances of having dengue hemorrhagic fever, the platelet count going very low, bleeding, and it's a much more life-threatening situation for you if you get dengue the second time. So it's very important to prevent dengue the first time and definitely prevent it the second time. And we need to work towards this. Now, what causes dengue? I told you it's a virus. But how does that virus reach you? And all of you kind of know by now, it is a mosquito-borne disease. It's a vector-borne disease. And this mosquito over here is the cause. Where is it? This side. Here it is. This is the one, which is the cause. Now, look at this mosquito very carefully. See the way it's sitting. That's the way the mosquito will be sitting. Unlike the Anopheles mosquito, which will be sitting at an angle, this is like more parallel to the ground. And it is black and white, if you can appreciate this. So if you see a mosquito that is black and white like this, that is the Aedes mosquito. And that is the mosquito that is responsible for dengue, for chikungunya as well. So it's very important that you keep away from these mosquitoes. And you need to prevent the bite from this mosquito. This mosquito gets the virus. Now, this is a very fierce biter. We call it the tiger mosquito for that reason, because it's a very fierce biter. It will bite multiple people. And that's the reason why you have dengue outbreaks as an explosive outbreak. Unlike malaria, will get one case and then maybe very slowly another case like that. But dengue will have some hundreds of cases together. It's an explosive outbreak because the vector that transmits dengue is a day biter. It bites in the daytime. So when you're around, so very often we think that, okay, somebody in this particular village has got dengue, so we need to do some fogging or something around that. But that person has not got dengue in that village. He's got dengue at the place he was working because it's a day biter. And there's a possibility that he would have got it at a different location altogether. So keep all these things in mind when we are actually trying to deal with dengue. So how do you recognize the signs of dengue? I know some of you might have got dengue. It is so common in Goa, unfortunately. Earlier, we had a lot of cases of malaria. Now, malaria cases have come down, but dengue is really rising. The signs of dengue, one is fever. So as of now, I would say any case of fever is dengue unless proved otherwise. So get yourself tested for it. Besides fever, you can have very severe body ache. You will have pain in the bones. You have something called retroorbital pain behind the eyes. That part pains. It's quite a kind of significant sign of infection with dengue. So it's very important not to ignore these signs. So fever itself, get to a doctor and get yourself tested. You can have nausea, vomiting. You'll have a rapid pulse. Your blood pressure may fall. You can have rash, bleeding from various sides. Nose maybe, your eyes may become red. So all these signs, don't wait for all the signs. Because dengue will have rash or something. No, dengue with fever. Fever itself could be dengue. Go and get yourself tested. Now, where does this mosquito breed? This mosquito breeds in clean water. And that's something, again, that we need to understand. What's the implication for us? Is because clean water breeding sites are all around our house. We can't be blaming other people for that. That sea of tranquility that you saw in the beginning of this session, the fields, there the Culex mosquito will breed. Okay, that's the mosquito that causes Japanese encephalitis and other diseases. But the dengue mosquito breeds around your house. So in coconut shells that are around in your garden, maybe some broken bottles, some buckets of water that you've kept for watering your plant or just happens to be there. some bottles or whatever around. Under your pots, you keep some plate sometimes. So water collects there. That's clean water, and the dengue mosquito will breed in. A little water is enough for it. It will breed, and the dengue spreads because of that reason. So what we need to keep in mind is what you do if there is a so-called infection for you. As I said for you in the beginning, think of the diagnosis. So first, the D of dengue itself will tell you D is diagnosis. If you have fever, get yourself tested. Where do you need to test? You can go to any testing center. All your primary health centers have facilities for testing. So you can go to your primary health center or health and wellness center and get yourself tested over there. There's a rapid test that is done, and they can do the test for dengue. Sometimes if you do too early, it may come negative. You may have to repeat it if your signs and symptoms are still there. Speak to your doctor, and the doctor will be able to guide you on what you need to do there. So first thing, D for diagnosis. D is also the fact that you need to drink a lot of fluids. You need to keep yourself hydrated. So if you're having dengue, I told you antibiotics are not going to help you. You just need to keep yourself hydrated. ORS, the oral rehydration salts that you get, keep yourself hydrated throughout the day, because that's what's going to help you in trying to combat this dengue disease. The platelets may fall, the platelets will rise after that. But in that period, you need to make sure that you take care of yourself. Eliminate all stagnant. The E of dengue is to eliminate all stagnant water around your house. So I told you that's where stagnant water, clean stagnant water is where it's breeding. If you eliminate the breeding sites, there will be no mosquitoes breeding, no mosquitoes, no dengue will spread. So it's important to understand the elimination of stagnant water around your house. N is to notify the health authorities. If there are dengue cases around your place, you need to, the health authorities by itself take cognizance of this. But if they have not for some reason, you can always notify the health authorities, because they can take corrective measures to come and correct and ensure that the dengue outbreak does not spread. There's no point crying over spilt milk. You need to prevent this outbreak from spreading. Once it spreads faster. The G of dengue will tell you get rest. If you have any viral infection, you always have to take rest. The other reason why you need to take rest is if your platelet count drops, there's a chance that you may bleed. So if you're not taking rest and there's some kind of injury, you may bleed, and therefore you need to try to prevent all such situations where you end up bleeding. Very often, because of the pain that is there, severe pain that is there, aches and pain in dengue infection, people tend to take painkillers like Brufen, etc. Do not do that, because Brufen and all these painkillers may additionally drop your platelet count, and that can be quite catastrophic. So avoid taking any painkillers. If you're taking any medicines, talk to your doctor and only then take these medicines, because it's very important for you to keep those things in mind. If you're taking tablets like aspirin, ecosprin, avoid taking it during this time. Speak to your doctor and do it accordingly. So it's very important that we keep all these things in mind. That was G, where you take rest. U is to use mosquito repellents to keep the mosquitoes away. Use screens on your windows to prevent mosquitoes from entering. And the E of dengue is to educate people. That's what we're doing right now. We're trying to educate people on to recognizing the signs and symptoms of dengue and how you can prevent this. Because prevention, I always say this, prevention is much, much better than cure. So try to prevent dengue, stay safe, and that's my sip for the day.